Sunana Nazifi Lawal daga Najeriya. A gaskiya a lokacin ina cikin wani mawuyacin hali. Lokacin ba na iya bacci, ba na iya zama. So shi ne na je asibiti aka auna ni a garin Talata Mafara. Aka auna ni aka tabbatar da cewa ina ɗauke da cutar hepatitis B.
Nazifi was actually, when he came, he had a history of weight loss, increase in appetite, and he had a certain investigation which were revealing that he had a liver SOL. We evaluated thoroughly and we found that this is a locally advanced intermediate stage hepatocellular carcinoma with the aggressive pattern, that is the thrombus was going into the inferior vena cava, and because of this basically he was losing weight and was going down in his general health rapidly.
Hence, after discussing in our multidisciplinary team, we decided to go ahead with giving them a transarterial chemoembolization TACE therapy along with the systemic therapy, and they tolerated the TACE therapy very well. Hence, we proceeded with a second cycle of TACE therapy followed by a microwave ablation of the liver lesion. On follow-up imaging, there was complete devascularization of the liver lesion with marked reduction in the alpha-fetoprotein levels and clinical improvement noted in the form of increase in the weight of the patient.
Dr. Peush ya yi ƙoƙari gaskiya bakin gwargwado, bakin iyakacin yin shi, kuma ina gode mashi, ina godiya gare shi, gaskiya ina godiya sosai. Allah saka musu da alheri.